Good evening, students. We're going to talk about the nervous system recap. Nervous system is a very important part of mobility. It includes two parts of the nervous system, the central nervous system, and particularly we're going to be talking about the cerebellum, and then the peripheral nervous system. And we're going to be talking about spinal nerves and the autonomic nervous system. The function of the nervous system in conjunction with our musculoskeletal system is this complex relationship between the neurons, the neurotransmitters, and the musculoskeletal system that allows us to have purposeful movement. The nervous system is broken down into two distinct parts. There's the central nervous system, i.e., the brain and the spine. And then there's the peripheral nervous system. The peripheral nervous system is made up of two additional systems, the somatic nervous system and the autonomic nervous system. And then the autonomic nervous system is further divided into the sympathetic nervous system and the parasympathetic nervous system. Now, the autonomic nervous system is going to be important when we start talking about spinal cord injuries, because without the ability to feed back into and give the brain information because of the damage in the spinal cord, it can lead to not only skin breakdown, but a disease process called autonomic dysreflexia. That can be triggered by something like constipation, or an overfull bladder, or a urinary tract infection. It can even be caused by wrinkles in the sheet because the body's periphery is trying to figure out a way to communicate back to the brain that there's a problem, but it can't tell you what that problem is. So all these peripheral nerves are being triggered from different sources. And the only way it can start to act up is by raising and changing vital signs. So we're going to talk about autonomic dysreflexia when we talk about our spinal cord injury. The sympathetic nervous system is also an important part at rest. It's essential for preparing the body for this fight or flight response. And the sympathetic system activates numerous complex pathways that enable an adequate response to trauma or to a threat. Some of those are physical effects like breathing faster so we can run away, increased heart rate, increased blood pressure, dilation of our pupils, and redirection of blood flow to important organs like the brains and the muscles, and increased sweating. Whereas the parasympathetic nervous system is a rest and digest. So we're going to talk about all of those when we talk about spinal cord injuries. And just a reminder about the spinal column, and the primary functional piece in the neurosystem is a neuron. And this neuron is characterized by axons and myelin sheaths. Myelin sheaths are going to be important when we start talking about demyelinating conditions. And then these nucleus and the dendrites and all of these terminals. And then these terminals in between each of the neurons, how they communicate is through neurotransmitters. These neurotransmitters, we have in many cases created medications to mimic them or to inhibit them. So some of our excitatory neurotransmitters include epinephrine, which actually is made in the adrenal glands. That is the reason that it's called adrenaline when we use it. We'll see this when we really talk about immune system responses, because we're going to give epinephrine to help the patient breathe better. And then norepinephrine is a vasopressor. It's going to constrict blood vessels in their diameter to allow littler volumes to pump and provide a decent blood pressure. So it's called a vasopressor. And then we're going to talk about glutamate. Glutamate is another excitatory neurotransmitter. And then our inhibitory transmitters that we're going to talk about this semester are serotonin. Serotonin reuptake inhibitors to prevent serotonin is one of the antidepressants. GABA is equally as exciting. Our GABA receptors make up about 75% of our brain, and so that's huge. So we're going to talk about GABA and how it prevents things like seizures and what happens specifically when it's trying to calm the patient down, but there's an absence of GABA and an absence of serotonin and dopamine in the brain. And then dopamine, let's just talk about dopamine. Dopamine, too much of dopamine is very addictive. It's short term, it's enjoying that extra piece of cake, it's felt by the entire body, and it inspires the person to want more. Dopamine and too much dopamine is what inspires us to gamble or to do risky behaviors because we get those high amount of rewards for that risky behavior. If we get really good grades in school, we want more. And so we're addicted to do better and keep working harder. And it provides us with that motivation to get the good grade. When we don't have enough dopamine, it's very depressive. And so we'll see that with Parkinson's. When we talk about Parkinson's and movement, a lot of what it is too little dopamine. So with Parkinson's comes depression, and we're going to talk about that as well. So serotonin primarily made in the GI tract, it does stabilize mood and anxiety. That's why we talk about comfort food. It's those good foods that help us relax and calm down and just reminds us of bygone days. And then it also helps regulate our sleep and our wakefulness. And then there's dopamine. Dopamine, mainly made in the brain, it affects motivation and pleasure. Rarely, though, do we create treatments that target dopamine function or increase dopamine function in the brain. It does help you feel more alert. And actually, when we're talking about dopamine, we're going to talk about carbidopa, levodopa with Parkinson's. And so I want you guys to have a really good understanding of how those work by the time we get done with our Parkinson's cases in class. And then some movement terms that you should become familiar with. Ataxia, atrophy or disuse. Atrophy is one thing that as nurses, we can really have an impact on our patients. So when they're in critical care, not moving around much, we need to do passive range of motion to keep those muscles getting blood flow to them and keeping them limber for when they do come back around. So atrophy and disuse is not just physical therapy. It's on us as nurses as well to work with our patients and move them and roll them and turn them. Huntington's chorea is a genetic disease. We actually have some patients in New Mexico that have this Huntington's disease. And I want to say it's Peru that also has like centuries worth of church data showing who had Huntington's chorea. I will find out exactly though the country, but I'm pretty sure it's like Peru, Venezuela, somewhere South America. And then myoclonus activity is a sudden, brief shock or pathological like epilepsy. And then tardive dyskinesia, we're going to talk about when we see long-term antipsychotic use. Tardive dyskinesia is the smaller muscles, that tongue roll, that lip smack, that we see maybe extra blinking. And so we need to look at what medications that they're taking. And then tremors, we're going to talk a lot about resting tremors and Parkinson's versus tremors from things like alcohol withdrawal. So we're going to look at the different causes of these movement terms, but you should stop the video here and define each of these terms so you're ready to discuss them. And then finally, we're going to work on some exemplars in class. We're going to talk about fractures first, and we're going to talk not only about long bone fractures and how to fix those, but then we're going to talk about pelvic and hip fractures. We're going to talk about different types of traction that we see with them. We're going to talk about pain and pain management. Then we're going to talk about spinal cord injuries. Spinal cord injuries, we're actually going to do a simulation based on the stages of spinal cord injury. So that should be really a great learning opportunity. And then spina bifida is one of the few diseases that we actually have some control over. It is not a NIMNIC required exemplar, but there are about 1,300 babies per year in the US born with spina bifida. And this neural tube disease is preventable by folic acid, but unfortunately, the neural tube is being developed in utero before frequently the person knows that they're even pregnant. So how do we improve diet and do education pre-partum so that they are taking the right vitamins that they need to have? And then Parkinson's disease, we're going to do a whole exemplar on Parkinson's disease. And as we move from mobility, we're going to talk about multiple sclerosis as a lead into immunity. It is an autoimmune disease, but there are stages and ages of multiple sclerosis that really make the person immobile. So we're going to kind of tie these exemplars together with immunity as well. All right, see you in class.